Bruce Marler, Senior Director of Revenue and Social Impact at Twilio. It's great to see you, Bruce. Thanks for coming on. We talked a little bit before we went on the air about the Department of Veterans Affairs, Veterans Health Administration using AI assistance for their healthcare providers. What's some of the value add that you've seen, the real progress that you've seen in healthcare provision as a result of assistance, technology assistance coming alongside healthcare providers? Bruce, welcome.
First, thanks for having me on here. Really interesting area to be talking about right now. There's a lot of innovation happening. Some of the real benefits we're starting to see from AI being embedded in the healthcare workflows has been around improved patient experience. Really, we're finding that clinicians can serve more patients, which at the end of the day provides better outcomes. If you really look at how it's starting to work, the AI assistants almost look like a digital twin for the clinician. And we know within the industry, there's a lot of burnout happening in the industry for clinicians trying to support patients because they have so much coming at them at one point. So with these AI assistants or digital twins, you can start to see where you can embed intelligence in the workflow so the AI can be listening and be picking up maybe tests that need to be scheduled or maybe summarization and notes or one of the things and I'm sure this will come up as we talk more, but is like real-time translation because you may have patients that the native language may not be what their doctor has. So you may have to find that, hey, I need to translate this to understand this better so I can get a better outcome and really communicate better about what needs to happen. So yeah, that's just some of the ways we're starting to see it. It's really been kind of an exciting thing to see.
What are some of the opportunities that maybe healthcare organizations are not leveraging yet to the degree that they could, that you expect to see spread out in the future, scale in the future?
Yeah, I think mixing contextual data with the communications. I think one of the things that we understand, and we've seen a lot with Twilio, has been the ability for communications to help people in need right when they need it. Our social impact team, which I'm part of, our Twilio.org organization, like we really focus on engaging people that need support on everything from healthcare to financial needs right when they need it. So I think it's combining that real-time communications on the channel that people want it, and that's a key part is what channel do they want to be communicated with or on, but also mixing that with contextual data now and taking rich data and combining that together to help that journey for the patient. And it could be, once again, to make it more efficient. So it could be communicating in the right language. It could be communicating at a time that's more convenient, but taking that data and acting on it. But also, if it's implemented properly and securely within the healthcare networks, it's actually able to like share that patient data with the doctor right away. So they can actually get right to work and focus on the patient rather than digging through notes or digging through histories. They can be presented with that rich data and be communicating at the same time and have a lot of efficiency there.
A federal CIO told me not too long ago that AI and the cloud are what she called conjoined twins. One can't move without the other one. One doesn't get anywhere without the other one. What's your sense of that connection specifically in the healthcare provision space and how AI will drive cloud adoption and transition and vice versa?
I think we've seen healthcare really show a lot of innovation over the last several years, and I think it only accelerates it. I think we've done surveys, and we did surveyed I think it was 400 organizations across nonprofit healthcare, public sector healthcare in this past year, and we're seeing rapid adoption of AI. A higher percentage, it was 51%. Over half of organizations had adopted compared to like 47% in the B2C market. So you really see an aggressive adoption there, and that's only going to drive the need for more cloud-based services. Or it really is kind of I hate to use the word synergistic, but it is, right? They really do go hand in hand. And you're going to see new use cases come from that, right? Like what we see when that happens is people are like, look, I have this use case. How can I go fast with this? Well, when you start looking at cloud-based communications, if you look at the AI tools, which a large portion are cloud-based, you really see the ability to rapidly deploy these and improve the concepts rapidly. But then if you're working with a provider that really builds trust and reliability, and in the beginning, you can rapidly scale those. And we're proud to be one of those at Twilio, where we start everything with a trust in what we build. We really want to focus on making sure they can rapidly deploy these in a scalable way they can trust and their patients can trust. Let's be real. At the end of the day, the outcomes for the patients are the most important things. So really, that's a core part is making sure you build trust and reliability in so you can rapidly deploy these things. But I also think other areas, and I've mentioned translation a few times, I think there's all kinds of use cases like that out there that are going to be cloud-based. To scale them, you have to be cloud-based. So I just think you're seeing more and more use cases that are going to have to be cloud-based to take advantage of the technologies that are out there.
We've spoken in this conversation so far, Bruce, primarily about the intersection of AI and healthcare provision from the provider's perspective. What's the opportunity that you see from the patient's or the consumer's perspective?
I don't know if the word would be exciting, but I think that's probably the way I would put it. If you think about the fact that a patient, we'll just back up. And a lot of times a patient will go in, they'll talk to their doctor, they get, here's your prescription, here's your test, here's a bunch of words I don't understand, right? So if you think about AI and cloud-based communication and now being able to take that and tailor it in a way that you could have summarizations maybe done in human readable format, let's say, right, where people are more likely to read it and understand what their outcome could be if they do the proper things. Or if you think about everything from something as basic as a patient notification for surgery, right? Like I need to go in for surgery at this time. Here's my reminder. When do I show up? What do I need? Those type of communications in a more timely way can really make a difference for a patient how they're doing that, and also just better outcomes in general because you're communicating more freely, maybe on a channel that you want, where before maybe it was on a voice call every time during the day at 3 o'clock when you're at work. Well, that may not work for you. So being able to really tailor these communications helps people, helps outcomes, helps the patient have a better experience. And they're probably more likely to go get healthcare. And, a lot of times people kind of resist because it's a lot of work at times because it is so busy. Um, in general, you're going to see patients probably more likely to talk to the doctor or talk to the AI agent, maybe to schedule their healthcare journey and what they may be needing.
How does that then inform the way that a public sector, federal government, healthcare provider should think about the way they structure networks, the way they structure customer journeys, all of that?
I think what it really should allow them to do is kind of rethink the communication in general, and I mean that in the very most fundamental way. Like, don't just think about a contact center. Think about a complete customer journey, right? Like, it's not just I'm going to call in, I'm going to hit an IVR. I mean, Twilio, we love IVRs, we love all those things, but we can enrich those with data now and make those more powerful. So I think that's it. Is don't just think status quo. I'm building my on-prem contact center and I can do these things and these are my features and that's all I'm ever going to do. They can think in a more flexible way that works for that patient. And efficiency matters here too. So it's not just about, how do I do more with this? It's probably going to, and I would say for sure we're seeing it provides more efficiency in general by taking about advantage of these cloud-based communications and then thinking about how do I communicate on the right channel at the right time so that communication is more valuable. Brings the patient in, makes it more efficient for the clinician too. So you have cost savings on that side. You have less burnouts. Just really rethinking how that journey should go, I think.
Bruce, it's great to talk to you. I really appreciate your time today. Thank you very much.
Thank you very much, Francis.